Hi everyone, today we are going to discuss how to prevent aging. Nowadays we know the longevity of humans have increased. In 1950s, average lifespan of an Indian male or female was 50 years. In 1970s, people used to die by 55 or 60 years. Now studies have shown that average lifespan for an Indian boy or Indian male or female is 75 to 80 years. And Japanese we know have a lifespan of 100 to 110 years. So our aging population is increasing. So people don't have any problem with aging if they are financially sound and physically healthy. But many times we know that when we are aging, we want to live healthily and people want to prevent aging. So aging prevention doesn't mean that you have to maintain your skin. Many people think that it's a cosmetic treatment of skin, maintaining your beauty without wrinkles. Thing is that is aging prevention. No, it is maintaining your muscles, maintaining your brain, maintaining your sexual activity, maintaining your heart, kidney, liver without having cancer. That is more important for aging. So what are the 7 now accepted strategies to prevent aging by scientific data? First and foremost to prevent aging is cutting off your calories. So basically, suppose your body is overweight or obese, you cut off your calories, your cells can live more. You understand it more scientifically. Suppose your body requires 20 kilocalories per day. Think of a person like me, age 40 plus with a body weight of 80 kilogram. My calorie requirement is actually 20 kilocalories per day because I am not exercising that much, or I am not having that much exercising body habitus, or I am sitting and working as a doctor. Another person who is a manual laborer may be having 30 kilocalories requirement per day. Suppose my calorie requirement as a sedentary person who sits from morning to evening for 8 hours is 20 kilocalories per day. My daily calorie requirement is weight in kilogram into calorie, that is 80 into 20, that is 1600 kilocalories per day. So calorie restriction means that suppose I am taking any calorie less than 20 kilocalories per kilogram, I am saving my cells much more. We know, we have studied in whatever schooling that mitochondria is the storehouse of energy for all the cells. The more food you take, the more the cells have to burn out, more the mitochondria have to work. And first and foremost by all the international studies to prevent aging is cutting off your calories. Eat less foods and invariably your cells will survive much more. So first and foremost to prevent aging is calorie restriction, CR, or cutting off your calories per se. Second is invariably physical activity. Physical activity or exercise for 30 minutes per day for at least 5 days per week, and weight training exercise for 30 minutes per day for at least 3 days per week. So how to prevent aging? I told you scientifically 7 program. 1 is cutting off your calories, restrict your food intake and allow your cells and mitochondria to survive much more. 2 is exercise 30 minutes per day for 5 days per week, and weight training 30 minutes per day for 3 days per week per se. 3 is adequate sleep. Now the study has shown that at least 7 to 8 hours of sleep is required for an elderly person above 30 years. That too nighttime sleeping, not daytime sleeping, because you know the circadian rhythm is controlled by the suprachiasmatic nucleus. So the sleep is 7 to 8 hours. That can also prevent aging by increasing the cell survival per se. 4 is probiotics. You know, nowadays people ask that whenever you take extra curd or yogurt or kombucha or fermented pickle or fermented chicken, your good bacteria in the stomach increases. So you know, good bacteria in the stomach is known as probiotic or live microorganism that can prevent aging by producing short chain fatty acids. So concising, I told you 7 methods to prevent aging scientifically, not the skin aging. 1 is cutting off your calories. 2 is exercise. 3 is adequate sleep. 4 is probiotic. Among the probiotic preferred is yogurt 100 ml twice daily, which can increase the gut bacteria and prevent aging by producing short chain fatty acid. 5 is accepted as a drug which can prevent aging, that is metformin. So metformin, that is glucophage, that is the first drug for any treatment of type 2 diabetes, now accepted as an anti-aging drug. How does metformin prevent aging? Metformin can prevent the inflammation of cells, and metformin can prevent the telomerase enzyme multiplication and prevent the cell death and increase the cell survival. And what about the hormones? 6 and 7. I told you 5 things. 1, cutting off your calories. 2, exercise. 3, adequate sleep. 4 is probiotic. 5 is metformin. 6 and 7 are supplements, which are the vitamins which can be helping in preventing aging. The most important 2 vitamins which is hypothecated to prevent aging is vitamin E and vitamin D. Vitamin D, we know you get from sunlight. 18 minutes of sun exposure per day between 11 to 3 o'clock midnoon. That is not recommended now because even 1 minute of sun exposure can promote skin cancer. So ultimately you take vitamin D 2000 units per day so that your vitamin D levels are kept in normal. And vitamin E, your marine drops or E code that is found in your GCC countries, it is thought to be a very good antioxidant and anti-aging agent. So sixth is always supplementation with vitamin E and vitamin D. And the last thing you have to remember, what about hormones for anti-aging? Two hormones which are preferred for anti-aging. Number one is growth hormone. Many studies says that as your age increases above 40, your growth hormone production comes down. That is somatopause. So you check your IGF-1 and take growth hormone and maintain IGF-1 in the mid-normal range. You can increase the cell survival, increase the lean mass and decrease the fat mass. And the last hormone which can be replaced is a sex hormone. So in a females having a menses that is stopping after 50 years, it is a menopause. Men having low testosterone after 40 is an andropause. Females with menopause, if they don't have risk factor, can take an estrogen replacement therapy safely till 55 years. Men with andropause, that is low sex hormone level testosterone, less than 3.5. Ultimately, these people come to us, endocrinologists, to prevent aging. You can meet an endocrinologist and take a testosterone replacement therapy provided your prostate is normal safely till 65 years. So in concise, understand, so many articles we did daily, so many beauty therapies for anti-aging. Anti-aging never means your skin is not aging and avoiding wrinkling. It is your healthy muscle, healthy brain, prevention of cancer, healthy heart and kidney. I am repeating once more, 7 cornerstone therapies. Number 1 is always cutting off your calories. Less calorie you take, more survival of your mitochondrial cells. Number 2 is exercise. Number 3 is adequate sleep, 7 to 8 hours of nighttime sleep. Now daytime sleep in the night, according to the normal circadian rhythm, it can also prevent aging. Number 4 is probiotic, your yogurt 100 ml or probiotic tablet. Number 5 is Metformin, the anti-diabetic drug. It's a powerful anti-aging agent by inhibiting the telomerase enzyme. Number 6 is 2 vitamins, vitamin E and vitamin D. 7 is hormone, testosterone replacement in men, estrogen replacement therapy in female, and growth hormone maintenance therapy or replacement in men with somatopause or low growth hormone level. So these are the scientific data to prevent aging. Go to an endocrinologist, discuss this and take the hormonal options, and always check the blood and check for the side effects, and then only take the hormone replacement and prevent aging. Thank you.